everyone. Welcome to the Pet Pawcast. I'm your host, Dr. Roberta Westbrook. Thank you for joining us this wonderful Friday. Listen, I want to encourage you guys to come on down to our campus for all animals. If you want to bring your family, your friends, make a day of it, please visit our campus, come to our adoption center, and look at all the wonderful pets we have available for adoption. Puppies, kittens, rabbits. There's so much to see. So just make a day of it. And I'd like to let you know that if you want to support us, please go to www.houstonspca.org and see the ways that you can help join and support our family here and help us to do more to save animals, like our girl here, Ethel. Ethel is our special guest because Ethel came to us several days ago through our rescue ambulance. She had some severe injuries and some wounds, and she's been under veterinary care with us for about a week. And when I was examining Ethel and looking at Ethel, she brought up a lot of questions about diseases that are related to the eyes, because part of Ethel's intake exam noted that she had several different diseases and conditions going on with her eyes. And it's actually fairly common in bulldogs, but a lot of these conditions can happen in other breeds as well. And so I thought I'd talk to you guys today about normal and abnormal conditions of the eyes in your pets, because it's something that you should be aware of. And that you can contact your veterinarian if you notice in your own pet. So this is Ethel, and start thinking about any questions that you have regarding eyes of your pets, and perhaps I can help you answer some of those questions today. So this is Ethel. Isn't she cute? Really, really cute here. But as you look at Ethel, you might notice that there are some abnormalities in her eyes there. Her eyes may look a little bit strange to you. And if you're looking in the corner of her eye there, you might notice a bulge in the corner of both of her eyes. It's kind of a reddish pink bulge there. And it looks like it's kind of rubbing up against the surface of the eye. And that's because it is. And we commonly call that cherry eye. You may have heard that before, cherry eye, and you may have wondered what that is. Well, interestingly enough, dogs have what we call a third eyelid gland. Cats have it as well, but it's a third eyelid gland. Dogs and cats actually have a third eyelid, and it's a little eyelid that lives in the corner of their eye that really is under automatic control. And that third eyelid can come up and cover the surface of the eye anytime there's some irritation, or oftentimes when the pets are sick or there's an abnormality there. Well, inside that third eyelid is a small gland, and that gland actually produces tears. It helps to produce tears to keep the eyes lubricated. Well, sometimes, particularly in breeds like bulldogs, cocker spaniels, chihuahuas, the gland in the corner of the eye, the third eyelid gland, actually proptoses or prolapses. And so we call that a prolapsed third eyelid gland, otherwise known as a cherry eye. And so what do we do for that? Well, one, it does kind of make their eyes look a little bit funny, and it rubs up against the surface of the eye. And so sometimes it can be irritating. And usually to fix that, it is a surgical correction. So Ethel will undergo surgery to correct that, that prolapsed third eyelid gland. And that just requires us to flip the gland back in place and suture it in place. So she's going to have that done there in the future, just to make sure that she maintains her eye health. So cherry eye is very common. You should talk to your veterinarian if you see a condition as cherry eye, because we definitely want to preserve that third eyelid gland if we can. Like I mentioned, it does help to produce tears for the eye and keep those eyes nice and shiny and fresh. So that's cherry eye. Do you have any questions for me regarding your pet's eyes?
Does a cherry eye hurt them?
That's a great question. So the cherry eye, as you can see, even on Ethel, it does rub against the surface of the cornea for many pets, and some pets it doesn't, but particularly in Ethel, because she's got somewhat of a short nose and her eyes stick out a little bit, that cherry eye seems to rub up against the surface of the cornea. And it can be irritating, very similar to if you have something in your eye and you're trying to get it out. Dogs and cats do quite well, and they tend to go about their lives. They may not notice that it's bothering them, but based on what we know from people, it's at least irritating. And so we do want to try to correct that. If it goes on for a prolonged period of time, it can actually create an erosion or an ulcer in the surface of the cornea from rubbing against it. And so we do want to prevent that. So this is one of the conditions that if you can, see your veterinarian and let's get it fixed.
What is there anything you can do to prevent cherry eye, like as far as like vitamins or eye drops or anything like that?
That's a great question. Prevention of cherry eye, and there really isn't anything to do. Most of the causes of cherry eye are because of abnormal development of the cartilage in the third eyelid. It makes the cartilage a little bit relaxed and just more prone to being prolapse. Sometimes it can happen from trauma or from dogs rubbing their face, on the carpet or scratching. But typically, it's genetic in terms of the cartilage that is relaxed in the eye there.
Is there a particular breed like bulldogs that are more likely to get cherry eye?
Yes. So bulldogs, we see it in Cocker Spaniels often, Chihuahuas, Shih Tzus, Lhasa Apsos. So, and really any breed of dog, but we certainly see it more common in dogs that are brachycephalic or have shorter noses.
Can you tell us, I guess you're going to do it today or tomorrow, exactly what you're going to do for this particular situation?
Yes. So for what we have to do for Ethel to fix the cherry eye, she does have to go under general anesthesia. And when she goes under general anesthesia, we pull that third eyelid kind of out and over the top of the lower eyelid there. And so what will happen is we'll be able to pull that third eyelid down a little bit. You can kind of see it bulging there. And then we create an incision around the gland and tuck it back in place. We just it's actually called a pocket technique. And we create a little pocket with our incision, and the gland that is popping out, we sink it back in place and suture it, and she'll recover, and you won't even be able to tell that cherry eye is there. Now, the success of this procedure varies. Generally, we say there's about a 50-50 chance of it happening again. And so it's very possible that if you've ever had a cherry eye repair in your pet and it popped back out days later, that's not uncommon. It's just because the cartilage is so relaxed there. There are certainly some procedures that may be more effective than others, but it's not uncommon for it to happen again. What we try to avoid doing is removing that gland altogether because, as I mentioned, it creates tears, and we need those tears to keep the eyes lubricated. So it's kind of in a last case scenario where we may have to remove that third eyelid gland if it continues to pop out.
I think a lot of people may not realize that animal shelters take care of animals in such a way. A lot of times people think that they just come here and we find them homes and then you're kind of on your own. What kind of advice would you give people if they adopt a pet from any animal shelter where they have that? Is there something that they can work with the animal shelter to perhaps get some help with that, or some advice on how to take care of this if they can't take care of it right away?
Yes. So many animal shelters have capability to do lots of procedures to get these animals healthy. Our veterinary team here is very skilled. We have a wide range of capabilities in terms of saving animals and getting them healthy and well based on the conditions that they come to us to. Not every shelter is able to do that, and not every shelter has a large veterinary staff. And so you may want to, if you're not adopting from the Houston SPCA, you may want to call the shelter and work out what their suggestions are if you are adopting a pet that has health issues that may need to be taken care of in the near future. For us, we like to do our best to put the animals up for adoption in the best condition possible. And we want to make sure that we identify and rectify any health issues that we find. Certainly, animals come through here hundreds a week. And so we deal with a lot of health issues, and we try to do our best to make sure that you're adopting a healthy, happy pet.
What are some other eye diseases that pet owners should know about?
Right. So Ethel is a perfect candidate because she has another common condition. Not only does she have cherry eye, she has another condition that some of you may have noticed, and it's called entropion. Entropion is where the lower or upper eyelids roll in. And what it does is it causes the eyelashes to rub against the surface of the cornea. So in the corner of her eyes there, the eyelids sort of roll in, and we want those eyelids to roll out. We don't want the eyelashes to rub against the surface of the cornea. So we want her eyes to be rolled out like that. But if I let that go, you can see they start to roll in. I want to roll them out. That's how they should look. But if I let that go, bloop, they roll in. And so what happens is the eyelashes there will rub up against the surface of the cornea too, also leading to irritation. So that is another surgical procedure separate from the cherry eye that Ethel will have to have. And what that means is, in order to get those eyelids to stay out, we actually have to resect a section of tissue. We actually have to cut away a section of tissue underneath the eyelid and roll it out and suture it back in place there. It's a relatively simple procedure. It'll give her a lot of comfort, but that's entropion. So she's got cherry eye and entropion, two very common eye diseases that we see in young dogs because they typically are born with those conditions. And so we usually see them in puppies. We can get them corrected. They could go on to live a happy, healthy life. So when you bring your pet in for these eye diseases, what is your veterinarian going to want to do? If you notice that your pet is having trouble with his or her eyes, first of all, what might they be doing? They might be squinting. They might be pawing at their eye. You might notice that the eye is red, irritated, or that there's discharge there, green, yellow discharge. Those are clues that there may be problem with your pet's eyes and you need to see your family veterinarian. And what are they going to do? They're going to probably do a series of tests to make sure that they can identify exactly what's going on with your pet. So one thing that they may do is you've probably seen this when you go to the doctor yourself. This is an ophthalmoscope. An ophthalmoscope will help us to look at the dog's eye. It'll help us to look really deep in the back of the eye so that we can see not only the cornea, but we can look past the cornea into the iris, past the iris into the anterior chamber and posterior chambers of the eyes, and even way back to the retina, and make sure that there are healthy parts to the eye. And so we usually will take this. It's usually in a dark room, and we'll kind of shine this light in the eye and look through the little eye hole here. And that will help us to look in the back area of the eye. We can see the optic nerve and blood vessels in the eye. And that gives us a really good idea about the health of the eye. So your veterinarian will probably start with something like this, an ophthalmic exam. They may also want to check your pet for ulcers. I mentioned that some of these conditions can create abrasions on the surface of the cornea. The way that we use that is we actually stain the eye. So we actually put a dye in the eye, and that dye will glow the eye a bright green if there's an injury there. So we use kind of a tool like this called fluorescein dye, and we can put the dye in the eye, and if there's any injury to the surface of the cornea, it'll glow bright green. So it's kind of a cool test, and it helps us to identify if your pet has a scratch on the eye, and we can get it treated as soon as possible. So those are some tests that you might see. Any other questions?
Are there any vitamins or any kind of preventative things that you can do just for their overall eye health?
You know, a healthy, balanced diet. So just like in people, you just want to have a balanced diet, because certainly there are some vitamins like vitamin A that can affect the vision. And so if you are feeding your pet a normal, balanced diet, then you should not need to supplement any additional foods or vitamins or anything related to diet if you're feeding a well-balanced diet. Usually the scientists who are developing these diets make sure that we have all the vitamins and minerals necessary to keep our pets healthy.
Okay. And what about eye injuries?
Yes.
I'm rubbing on the carpet. I think you mentioned that, or being out in the grass.
Yes. So eye injuries are common too. And one of the things that can cause a lot of eye injuries are different types of trauma. So this is a very common and kind of interesting way that we can get injuries to the eyes. And that's if you have multiple pets. So if you have multiple pets and they're playing and they're kind of, playing around in the house and they're pawing at each other, oftentimes the toenails of one pet accidentally scratch the surface or the cornea of the other. And so we see some injuries that way, where an animal may have been are noted to be playing with their housemate got a scratch in the eye, and that's when they started to feel bad. So that certainly other types of more serious trauma, hit by car and things like that, can certainly cause some trauma to the eyes. Also, a common thing is, think about when you're riding with your pet in the car and you let your pet hang his or her head out the window. It's really wonderful to watch them take in all the smells and all the sights, and they seem to really enjoy it, letting the wind blow through their hair. But we should be careful, because sometimes they can get debris that flies into the eye, just like the wind blows, and little, grains of dirt and debris can get in the eye. And so that's something to be aware of too. Just be careful if you're letting your dog hang outside of your car or truck window. That it certainly could put them at a slightly increased greater risk for injury to the eye.
Tell us a little more about cataracts.
So how do you know when your pet has cataracts? It's important to distinguish the discoloration in your pet's eyes from cataracts, or a different condition that we call lenticular sclerosis. Now, it's a long term, but what you see is, as your pet gets older, think about your pet, if they are 7, 8, 9, 10, you might start to notice that their eyes start to look gray or blue. And oftentimes when they start to look gray or blue, we immediately think, oh, they're getting cataracts. But lenticular sclerosis is a condition different from cataracts. It causes a graying of the eye, of the lens in the eye, and it's a normal aging change. Those pets that have lenticular sclerosis, or sometimes it's called nuclear sclerosis, that condition is very visible. They can see completely through those eyes, and it's not like a cataract in which the lens becomes completely opaque. Think of a cataract as the lens being white. So if you look inside a dog's eye and it looks white, or very gray, that is more likely a cataract. And you will notice that your pet's vision is affected with the cataract. They may begin to run into walls. They may not be able to navigate their home very well. That's because a cataract is so opaque they cannot see through it, as opposed to lenticular sclerosis, where they can see through it. It's a normal aging change. Well, I know that was quick information about all things eye related in your pets, but if you notice any abnormalities in your pet's eyes, and that can be discharge or excessive tear production or squinting or pain, please see your family veterinarian. They'll get your pet in good health right away. In the meantime, we will continue to take care of Ethel and get those procedures on the books so she can find a home with one of you. So thank you guys for tuning in to the Pet Podcast. I'm your host, Dr. Roberta Westbrook. This is Ethel and Lisa and the whole team, and we'll be happy to see you this weekend at our Campus for All Animals. Come back and see us next week.